Good afternoon and welcome to HealthSystemCIO.com's All-Star Panel, How to Ensure Your Business Continuity Disaster Recovery Plan is HIPAA Compliant, a webinar tweet chat combo from HealthSystemCIO.com sponsored by Zerto. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief at HealthSystemCIO.com and I will be your moderator today. We are holding a simultaneous tweet chat hosted by Kate Gamble, our Managing Editor and Director of Social Media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can view the tweet chat in the Media Viewer panel on the right-hand side of your screen. Other WebEx panels we're going to use today are the Q&A panel, which you'll use to submit any questions that come to mind throughout the event. You can send them in as they occur to you and leave the default set to all panelists, and we'll take those later in the program. And we're also going to do some polling today, so you can go ahead and your polling panel will open automatically when I send those questions out to you, so you can answer those and we'll be able to discuss the results. And you can download the deck using the URL on your screen. It's at the bottom of the slides and will also be sent out in the chat box. Just so you see how we're going to spend our time today, first we're going to have our main panel discussion. We're going to go 30 to 35 minutes. On our panel is Dan Moriel, VP and CIO at Untitled HealthSystem, Todd Pappas, Network Engineer with Yakima Farm Workers Clinic, and Jennifer Gill, Director of Global Product Marketing with Zerto. So without further delay, we're going to jump right in. Dan, can you give us a little overview of your organization?
Yes, and good morning, and thank you, Anthony, for inviting me to participate. Untitled HealthSystem is a healthcare system located in central western New Jersey. We have one hospital, which is about 180 beds, but have locations throughout 4 counties and do approximately 1 million ambulatory visits a year. So as an organization, we are a small hospital, but a rather large health system. Hunterdon was founded in the mid-50s by the community in order to foster and stimulate community health. So as an organization, we like to think that we have a 60-year head start on population health, as it's something that we've been doing since inception.
Very good. Thank you, Dan. Todd, a little bit about your organization.
Hi, good afternoon. My name is Todd Pappas. I'm the network engineer at Yakima Valley Farm Workers Clinic. We are primarily all outpatient. We have 40 clinics throughout the Pacific Northwest. They founded the clinic in 1973. It started with 3 doctors. We now have over 150 providers. I believe we see we have about 650,000 ambulatory encounters a year. We're very diversified. We're an Epic customer, and we don't just cover the medical, but we also cover behavioral health. We do dental, and we're just starting optometry in about a month. So.
Very good. Jennifer, a little bit about Zerto.
Yeah, so Zerto was founded in 2009, and we started shipping products in 2011. We're a global organization with offices throughout Europe, Asia Pacific, and the U.S. We have over 4,000 customers around the globe, and our goal is to deliver a world of uninterrupted technology for businesses and people, and so to help customers achieve resilience for evolving IT. And so what that means a little bit more tactically is we provide hypervisor-based replication with automation and orchestration to really accelerate recovery times. Because we're in the hypervisor, we make it easy for customers to incorporate new technologies. In terms of healthcare, we have many healthcare customers that are using Zerto for disaster recovery for applications like Epic, Meditech, Allscripts, and others. So that's what we try to do here at Zerto.
Awesome. Very good. Thank you, Jennifer. Todd, let's start with you on this question. Tell me about the role of IT in your organization.
Well, we play a pretty important role. We deliver the EMR services to all of our clinics. Everything is electronic. We provide, all the security, all the storage, the PAC systems, the disaster recovery, the high availability. So we're pretty well integrated, and we have an amazing CEO that's very visionary and embraces technology. So we're very important to the organization, especially when it comes to disaster recovery.
How many folks on your IT team over there, Todd?
I believe it's 63 people.
Okay. Very good. Dan, the role of IT at your organization?
Well, the role of IT at Hunterton is probably similar to most healthcare systems. It's pretty pervasive. We touch every department. I like to think of IT as the glue that holds everything together. The roles within IT cover not only technology and applications, but we are also responsible for clinical engineering, medical records, and responsible for delivering services, not only to those buildings on campus, but to all of our ambulatory sites, and we contract with several physician offices to support their environment as well.
Very good. Dan, let's stick with you. What are the most critical applications you need to protect?
Well, our critical applications are really defined by our users, but in our most recent exercise of doing that, it's pretty obvious. It is certainly our clinical systems. We look at our financial systems, particularly our registration and billing systems, as critical. Email was elevated to a critical status, that is a Tier 1 status, as well as internet access. So understanding that priority was given to those applications that are enterprise-wide and pervasive as a Tier 1. Tier 2 applications are those that are more boutique-y. So, for example, an endoscopy system or a system for doing voice recognition are more boutique-y and specialized. And then our Tier 3 stuff is items such as archiving and those items that are less transactional, those systems that are less transactional.
Very good. Todd, most critical apps?
The most critical app is our EMR, our Epic system. And with that, we have most of our services rolled into Epic right now, with the exception of dental. So, first priority is the EMR, the dental system, the optometry system, and then our level 2 is our more of our ancillary support systems, like communications. So our telecom system, our email system, faxing, the imaging system, and then we have our infrastructure stuff, more of Tier 3, like our domain controllers and the DNS servers and the encryption systems.
Okay, very good. We're going to do a quick poll now, so I'm going to open that. If you could answer it, that would be great. When did you have your last service interruption? So either answer it if you're with a health system, answer it for your health system. If you have a customer at a health system or you're a consultant or an analyst dealing with a health system, just answer this based on maybe what you know or your awareness. We're not looking to get super scientific, just have a point of discussion. So when did you have your last service interruption? Please answer that, and we will take a look at that in a few minutes. Next question. Todd, let's stick with you on this. What is the impact of downtime to your organization?
Well, first and foremost, there's a, there is a financial impact if we're down. We have gone through a service interruption more than an hour, and the financial impact is obviously very, very substantial. Not only that, it poses a patient safety issue when all your systems are down and the patients are in the middle of being treated. So there is a safety factor as well, and delivering the service to our patients is very, very important as well. So with that said, we have really tried to take steps, especially using the Zerto system, to minimize and mitigate those risks.
Very good. Dan, impact of downtime.
So we've estimated downtime to be worth about $160 a minute. So on a financial arena, an extended downtime can be quite costly. But I think more importantly for us is the potential danger that it poses to both the quality of care and the safety of those individuals in our care. And those are areas that are harder to quantify in terms of dollars, but certainly have a more emotional and significant value to the work we do and the efforts we are doing to keep our systems available and error-free.
Very good. Jennifer, thoughts on the impact of downtime?
Yeah, so we hear from a lot of healthcare customers, a lot of the things that Dan and Todd kind of mentioned. So its impact to the patient care. Also, we support companies that support hospitals. So, for example, they have data coming in from all the departments of the hospital to a central place where they're monitoring that for like an infectious outbreak or things like that. So they can use that kind of data analysis. So if that's unavailable, that is going to really impact patient care because it kind of slows down the ability to detect and contain those types of things. And then, of course, it does get to financials. We find that hospitals and financial institutions, when I speak with them, it's funny when Dan mentioned a dollar amount, I was like, yep, I can tell you it's in healthcare because they know the amount by the minute because it is a financial impact. And then most importantly, of course, it affects patient care.
Very good. Jennifer, let's stick with you here, and we are going to look at the poll results. And looking at those results, we see that 59%, if we add up CNA, we see 59% have experienced downtime in the last 6 months. So certainly the majority. So your thoughts on that, Jennifer? Is that kind of what you expected, or you expected to be higher or lower?
Yeah, that's it's maybe a little lower than what I expected. We've seen data across, the industry that shows, between like 50 and 75% have had an outage in the last year. So that is not surprising to me at all. And it's because I think in terms of a service interruption, what's causing that is getting more and more creative, unfortunately, for the IT administrator. It's not just, the typical things that might happen, like a drive goes down or you have a power outage, someone trips over a power cord, and then of course you have weather events. But now we have things like ransomware and cyber attacks are getting more creative in terms of, getting into the data center and trying to take things down and to interrupt patient care. We see hospitals being targeted for that more and more. So this is really in line, maybe slightly lower than what I would expect to see, but this is right in line with what we see from the industry and our customers.
Well, Dan, Jennifer just mentioned unusual outages, so you want to quickly regale us with the story I know of your experience with an unusual outage?
So we had a digital wildlife event in early spring where a groundhog fell into a utility hole and started to eat through our fiber optic cable that connected most of our campus, at least the northern side of our campus. Unfortunately, it interfered with our redundant data center, and because our servers couldn't sync, they decided to turn themselves off, and we experienced about a 10-hour downtime on our clinical and registration system.
Talk about unusual, right?
Yes.
All right. Dan, let's stick with you here. Can you tell us what parts of HIPAA you must meet and your strategy to do it?
Well, you know, Anthony, I think we do a disservice to the community if we think in terms of just HIPAA, and I like to think in terms of privacy across the board. So certainly we have to meet certain HIPAA requirements, have our data encrypted, have BAAs with our third-party associates, provide significant education on privacy and what HIPAA really means. Interestingly enough, one of the things that we've discovered is that most of our clinical staff really does not have an understanding of what HIPAA was, intended to do or what it means. So we've recognized that we have more training to do there. But I really like to look at the bigger picture in terms of what is my environment doing to keep all of my data, you know, within the walls of the organization, and what kind of controls and auditing do I have in place to monitor that activity. So we look just beyond patient health information, and we're looking at, you know, credit card information and certainly corporate files and all of that other work. So we think of HIPAA as just one portion of our overall, you know, privacy model that has to be monitored and protected and guarded.
Very good. Todd, thoughts about HIPAA?
Yes, you know, we look at a more of a comprehensive approach on HIPAA. I'll be honest, I don't know all the rules and regulations with high-tech and HIPAA. What we do know, though, is we have to keep the data secure. We have to keep it archived and backed up and always available. So, you know, right now, security is forefront on our minds. And, you know, keeping that data very, very secure and away from people that don't have a need to know from it is paramount and important. Not only that, you know, we are always focused on security of that data, keeping it secure and keeping it unfettered, meaning that no malware on the system, no ransomware, nothing gets encrypted. So when we think about HIPAA, we're always talking about data availability, that the providers always have the data, it's always available, it's secure. People that don't belong in the system, we're trying to keep out. And we're also worried about, well, how can we rapidly recover that data if, you know, we did get attacked with ransomware or what have you. So it's very, very important that, you know, security is just forefront right now, especially in the, you know, the climate of the hackers and offshore hacking and whatnot. So.
Absolutely. Thank you. Jen, anything to add about HIPAA?
Yeah, so we've done a little bit of research on our end to see how Zerto would fit into HIPAA and play a role there. And the two things that stood out to me is, one, you have to be able to recover your data in the event of an outage. And then second, you need to demonstrate that you've done a disaster recovery test annually. There may be more pieces of HIPAA, but those are the two. Actually, I know there are more pieces in HIPAA, but those are the pieces that we really focus on. And with Zerto, we make it very easy to recover. So through the replication, we use continuous block level replication. So you're going to get data loss measured in seconds. And then through the automation that I mentioned in the corporate introduction, you're going to be able to recover those applications really fast. So just to provide some context, we have a healthcare company, they're protecting 600 VMs with 150 terabytes of data, and they're able to recover all of that with 7 seconds of data loss, and everything's up and running and available to end users in 25 minutes. So that really helps reduce that impact, but it also helps demonstrate that, hey, we can recover. And when you do non-disruptive testing with Zerto, you'll get a recovery report that you can give to the auditor that satisfies those requirements as well. And it's funny, unfortunately, compliance officers and auditors don't seem to be very popular with IT, but I have heard from some of our customers that the recovery reports has strengthened and simplified the relationship between those two roles. So that's been very exciting from that point of view. And then I do want to touch on one other thing, just since Todd mentioned ransomware and the security of the data. So plan A, so you try to keep everybody out, you have your firewalls up, you have everything secure, but then you kind of need your plan B to recover just in case they do get in, because remember, you need to be right all the time, and the hackers or the bad people, they only need to be right once. So when they do get in, you have to have a recovery plan in place, and that's where Zerto can help as well. And that helps demonstrate further compliance that, no matter what the interruption is, power outage, ransomware, the, unusual wildlife events in the data center, you're able to recover.
Very good. All right. Let's go with you, Todd. What are the SLAs that you have to meet, the service level agreements?
Well, we have to have, in an event of a service interruption, we have to have Epic up and running in 45 minutes. Our RPO, organization sets RPO at 5 minutes. However, we're about 5 to 7 seconds on our RPO, and our RTO is 45 minutes for our Tier 1 systems, such as the EMR and the dental optometry.
Todd, is there anything about frequency? So your 45 minutes is your SLA, but what if, you can't have it happening once a day. So is there a frequency that you're allowed to have those downtimes?
Well, we're fortunate in that we're outpatient, so we're not really 24/7. So okay. We do get, they do allow us some quite sizable maintenance windows.
Okay.
So we're lucky in that regard that, most of our clinics close by 9 p.m. So we have some flexibility there.
Okay. Dan, is it a different situation with the inpatient side in terms of the SLAs?
So we really don't have SLAs around disaster times, primarily because we've taken a very different model. And by that I mean we took the disaster recovery model and kind of flipped it on its end. And our position is that we take our effort on making our systems continuously available. So it's about business continuity, and that disaster recovery is what happens when your business continuity plan fails. So,
okay.
So we've got it a little reversed and a little messy. So most of our efforts are concentrated on keeping the systems connected and available, and that really covers a variety of areas, mostly around appropriate downtime procedures that we keep practicing and training, identifying single points of failure and remediating those, finding alternate routes of delivering data to a unit, to a building, to a department in the event of something more large scale in terms of interruption. So that by the time we actually get to a disaster, such as our digital wildlife encounter, if we reach that point, then it's kind of all holds barred. It's best case scenario to resolution, and we go to great lengths to provide people a continuous update on status and remediation that's going on.
Very good. Jen, these gentlemen have talked about the service level agreements they have internally they have to provide. But what about some service level agreements that Zerto might offer its customers?
So, well, because the customer buys the software, we don't really provide a service level agreement per se, but we are able to work with customers to help them design how they want their failover plan to work so they can meet a specific service levels. So for example, someone might have some applications that need to be up and running, you know, in a few minutes, like 3 or 4 minutes. So we can work with them to make sure that when you're designing your failover plan, that you want to have those up and running first, and then you kind of do everything else second. We do have SLAs in place in terms of our support organization, of course. So we have 24/7 support, and then business hours only support, although I believe everyone pretty much is a 24/7 organization now that, you know, basically you have a website, you're on Twitter, you're on Facebook, whatever it is, how you're connecting with your customers and consumers. So most, I would say, I think almost 100% of our customers are on the 24/7 support model. So that is one SLA that we have.
So your customers, you would work with them in order to help them set things up and set up the software so that they can properly meet their internal SLAs, correct?
Yes, and we're able to do things like we have tools, for example, within the journal. So the journal is kind of like TiVo for the environment. So that's 1 hour up to 30 days of historical checkpoints. So if they say, look, for our service level, we need to be able to go back a week in time, we can help them size up the journal and how big it needs to be to make sure that they're able to do that.
Perfect. All right, we got another poll we're going to throw out there. So let's open it right now. How often do you test your DR plan? And there's a little joke at the end. Weekly, monthly, quarterly, semi-annually, annually, we are supposed to test the plan. So go ahead and answer that. This is an anonymous poll. We will not be releasing your name associated with your data. So just for the point of discussion, go ahead and let us know how often do you test your DR plan, and we will revisit that in a few minutes. So go ahead and answer that question. Dan, let's go with you on this. How do you prove to the business, and you said this may not be actually an appropriate question for you, how you prove to the business that you're meeting your SLAs and compliance requirements. What about the compliance requirements? Does anybody want you to prove to them that you're in compliance, or just the government?
No, we actually turned over all of our audit responsibility to our compliance department and put the burden on them to keep IS honest. Oh yeah, no, that was the best thing I ever did. So they're real diligent in making sure that we're meeting all the criteria as far as testing and models. We probably test our business continuity plan more frequently than I'm happy with admitting, but I would say we have a really good solid test about every 6 months.
Okay.
So every time something malfunctions, we work to document it and use that as one of our validation events.
So just to clarify, do you feel like 6 months is a good frequency, or would you like it more or less?
No, actually, I would like it less. I would like it to never happen. But I think 6 months is reasonable because in any healthcare organization worth its gusto, our environment every 6 months has probably got some dramatic changes in it, and This is an opportunity to redocument and validate that what we have in place is sufficient.
That's a very good point. If you could just expand on that for a minute, the concept that you're not sort of testing the same exact thing every 6 months. Your environment is changing. It's dynamic. Applications are being sunset. They're being put on. Sometimes applications are being added that you don't even know about. We have a webinar coming up on IT governance, and that's one of the issues is departmental buys that you don't even know about. So, but to your point, I just want you to reiterate or expand on the idea that your environment is changing, so therefore it needs to be retested.
Sure. You know, we are in a constant state of evolution. A large part of what we're doing here at Hunterton is consolidating our application portfolio, which is probably more complicated than it needs to be. That's predicated from the fact that for many years, departments went out and bought whatever they wanted. In the past couple of years, we've started to consolidate that effort. So as we consolidate systems, so for example, I'm reducing from 5 document management systems to 1 enterprise class document system. Now that I've consolidated that, document management becomes not a tier 2, but a tier 1 level application. So when we have a failure, how do we make sure that we've got that software in the loop and that we validate that it's operational or working as it should, and have the staff and knowledge in place to, to perform restorative action as well as routine maintenance. Does that make sense? Was that coherent?
Somewhat. No, I'm just kidding. No,
okay.
That was very good, Dan. I appreciate it. So just our New Jersey humor. Todd, can you talk a little bit about SLAs and compliance requirements and how you prove that you're meeting them to the business?
We do a semi-annual full interruption test to our DR site. All the stakeholders are involved. We're required by our vendor of our EMR to do these at least semi-annually, and they're actually either on-site or on the phone during the full interruption test. They go through a very methodical checklist to make sure that we are hitting every point and delivering every service that they lay out for us. It's an organizational and HIPAA and a government requirement, but it's also our vendors they really push us to make sure that those systems are always available. And so we're lucky in that respect, and that they guide us through that whole DR process, but we have to we have to prove it to them. We can't, check a couple of boxes and said, yeah, we did a DR test. They're either there, they're on the phone, their testers are on there validating the database and all the data. So it's kind of an intense white knuckle ride, to be honest with you, when you do a full interruption test, because a lot can go wrong. So it's very, very well orchestrated, and with the vendors and stakeholders involved, without a doubt, there's plenty of proof to the organization that we do the DR test and it was successful. If not, we correct those issues rapidly, and we usually retest within a few months.
Very good. Jennifer, is there anything you want to add?
Yeah, so, in terms of proving to the business, I already mentioned the recovery reports. And with Zerto, we actually, because we do enable non-disruptive disaster recovery testing, so you can test during business hours. And you need to be an expert in the event of an outage. So if you're practicing something that you're going to be an expert in only once a year, when that outage occurs, you might be out of practice. So we encourage a lot of testing, and because it's non-disruptive, leveraging Zerto Virtual Replication, you can do it as often as you want. I have a customer who tests, now this wouldn't be the whole business continuity plan, obviously there'd be other factors, but in terms of the data and the applications, this is something you can do quite often, and we have a customer who does it once a week. He fails over his environment non-disruptively and runs a quick test. And I was following on when Kate had the Twitter feed up on the right-hand side there, I saw the compliance officer, someone chimed in, hey, I'm a compliance officer, I'm not popular with IT, build a relationship. But with Zerto, the compliance officer and IT will be best friends because they get that report, they're happy, and actually I found at organizations that do have Zerto, they turn over the testing to the compliance officer because it's that easy to run.
I think that's what Dan said has made him quite happy, so maybe other IT folks will enjoy it. All right. Actually, Jen, let's stick with you. We're going to look at the poll results. One person took us up on our humor answer, but otherwise pretty much everybody is either annually or semi-annually. Do you have a feeling on best practice out there among your customers? Yeah,
so our customers, I find the most are in the quarterly range, although we do have some do semi-annually and annually, yes. But it's just because it is so easy to run a test with in terms of the data and applications. Now, if you're running a full test, like Todd talked about, a full interruption, so that's going to involve more things than just IT usually. So I understand those cannot be done as often just because of the resources and things like that. But I'm glad to see that people are doing at least semi-annually and annually, and I find that that lines up with most compliance requirements like HIPAA, but also SEC, SOX, et cetera. They require an annual test.
Very good. All right. Todd, let's go with you on the next question. And I want to encourage the attendees to go ahead and send any questions in that occur to you in the Q&A box. Leave the default set to all panelists. Todd, what additional threats are you concerned about in terms of information availability?
Well, what we see a lot, and, you know, I imagine this applies to a lot of organizations, but, you know, you talk about environmental and natural disaster type events, you know, really that is definitely valid, and it does happen in the case, you know, in Dan's case. But, you know, we also see self-inflicted issues. You know, you may have a new staff member that accidentally shuts down a server, or something has been configured wrong and it makes the service unavailable. So, you know, we've seen a lot of self-inflicted issues throughout the years, and not just our organization, but every organization. You know, we hate to admit that, but yeah, we do make mistakes, and sometimes services do get interrupted, and IT may be the cause of that. And so, you know, and that's the nice thing about our DR system using Zerto, and I stress this to everybody when people start freaking out and you have a service down, it's like, listen, I can, you know, within 1 minute, I can have that server up at the DR site. You know, we're not talking about moving the whole system. It might just be one part of that system that's affected that I can spin up within a minute. I can roll back, because we used to keep, you know, 24 hours of journaling. Well, I've now expanded. I'm keeping 30 days. So I can roll back at any point, like a DVR or TiVo, and I can have that service or that server up, you know, within minutes. And that's really powerful, and that's something in management that's it just blows them away that we have that capability to just we can go in there granularly and bring that part of the system up somewhere else, and that's amazing.
Very good, very good. Dan, thoughts about you know, other threats that you're thinking about?
Well, you know, I think the thing that troubles me the most these days, or what I've come to consider a threat, is regular and routine software upgrades from our vendors. I think over the past few years, certainly what we've been experiencing here is the quality of the upgrades are not stellar. And very often exceed our capacity to adequately and appropriately test the environment. So we've had a whole series of upgrades which have resulted in unanticipated downtimes. And I'm starting to categorize that as a new level of threat.
Right.
No, I'm serious, because it's probably more disruptive than when we have a total system failure, because it's, you know, partial downtime procedures in one department, maybe not in the other, and then reconciling that environment at the end of the episode tends to be tedious and difficult.
No, I appreciate it. I get it. And Jen, I wonder if you've got any thoughts about that. Have you seen this becoming an issue out there with customers, just upgrades from their vendors?
So yes, actually, and so customers use Zerto to kind of help mitigate that risk. So what happens is with the journal, once you do an upgrade, apply a patch, something, and it's just not acting right, you can just roll back the environment and then apply that patch or upgrade maybe during a weekend or at another time that's a little less risky to the organization. From a Zerto perspective, we hear this from customers. They want to make sure upgrades are pretty painless. And it's funny, I do the what's new in, you know, XX version webinars for the company usually, and the last one I did was what's new in 4.5, although we are on 5.0. And I get asked that question, you know, how hard is it to upgrade? How long does it take? And I had 2 customers that were on the webinar message me and said, I upgraded during this webinar and I'm all done. So that's the goal with Zerto. We design everything with simplicity in mind, and we want to make sure that that doesn't happen so that organizations such as Dan's aren't hit hard with upgrades and patches. And so I think software vendors as a whole need to be really aware of the frequency of releases and making sure that when an upgrade is needed or when customers want to perform an upgrade, it's easy, simple, and non-disruptive. So I think I have heard that from customers, and quite frankly, they've used Zerto to undo upgrades of other products because it has been not right after they applied the upgrade.
Right, right. All right, very good. We have a few Zerto-specific questions, and so we're going to go to Todd on this, who is a customer. How does Zerto virtual replication help with your DR requirements, Todd?
Well, we can easily maintain compliance because, you know, one of the things with Zerto is it's, you know, for us, it's very, very easy to learn. It integrates pretty seamlessly into our hypervisor. Just about anybody, if we lay out in one page, I can tell you how to work it, how to fail over. It's that easy. And I think for us, it's about, we're automated now, but if you were to fail over manually, we can do it probably, I think, in about 5 or 6 clicks right now. And it makes things so much easier, and it's, you know, it's SAN agnostic, and it's just very simplified, very robust system. We've been using it, I think we've been on it for 3 years now, and it's just been, the management can't say enough good things about it. And I'm being totally truthful and honest. We've got a lot of good compliments from our organization and, you know, from our EMR vendor, Epic. They said, wow, what is this thing? We've never heard of Zerto. I said, well, that's what we use for replication and DR. And they started having their customers call me because they're, what is this new thing? It looks so easy and it's so seamless, and it really is, and it really does deliver. There's not any hype on this. When I say it's, you know, you get a 7-second RPO, you get a 7-second RPO. It's been proven. So,
Jen, that's about the best endorsement you're going to get there, huh? Jennifer, are you still with us?
Oh, yes, I am. I'm sorry. I went on mute because it got noisy around me. So sorry about that.
You know, it was such a good endorsement, you were speechless. That's what we have to say.
Yes, exactly. So we have great customers, and they love the product. The most common comment I get from customers is, your product does what you say it's going to do. And if you just do that, you'll make people happy.
Excellent. Very good. All right, we're going to go with our final poll. So let me open that right now. Is ensuring compliance a top concern for you and your IT organization? Be honest. And remember, I promise this will be not be leaked to the media. So don't worry about that. So we have our final question, then we'll go back and look at our poll results. So once again, Todd, anything you want to add? I think you were pretty comprehensive on your last answer, but about your experience with the DR testing within Zerto virtual replication.
Not too much more to add. It's just it's very simplified and intuitive. The user interface is streamlined, and really I can teach a non-technical person how to fail over a server pretty rapidly. It's just that well laid out. It's that easy to use. And that's been my experience from day one with this particular product, is that it really does deliver, and it is very, very intuitive and pretty easy to use. There's no fancy scripting, and it's all, we can manage a system on one pane of glass. Yeah, I can't say enough good things about it. I think that's probably about it.
Very good. Jen, anything else you want to add there?
Yeah, actually, what Todd mentioned and teaching other people how to do it, we've had customers say putting together their DR plan was like the worst month of their life because that's how long it would take to execute the test. And now they've shown their compliance officer, has shown someone else how to do it, and now they're not even involved. So it's very easy, as Todd mentioned, it's intuitive, it's a simple product to use, and it meets the compliance, pretty stringent compliance requirements we're able to meet with 3 pushes of a button.
Very good. We'll quickly look at our final poll. 80% said yes, ensuring compliance is a top concern. We have one honest person, I'm just joking, who said no. Dan, Dan, I'd like to get your thoughts on this. I guess listen, let's say you're in an organization where you don't feel like ensuring compliance is a top concern. You're in IT, you're leading IT, but you don't feel like it's a top-down priority. What can you do?
Well, I think a lot of that's going to depend on the governance model that an organization has. But for me, in my current environment, I would first elevate it to the steering committee. And if I was unable to get them to recognize this as criteria, then I would just bring it to executive committee and the compliance board. But I have to confess, I've never had to do that, and that we've been effective in communicating the importance of maintaining compliance.
All right, Dan, let's stick with you. Final thoughts, advice, or lessons learned. Anything come to mind before we go today?
Let me reiterate what I said earlier. I think disaster recovery is less important than business continuity. I would urge people to think about their models a little bit differently and do everything you can do to minimize those single points of failure, optimize the training in downtime procedures, and do everything you can to ensure that your systems are available as much as possible. And that when they fail to become available, you'll generally have a disaster which is of moment and noticeable, and then have your plans in place and your models in place to react to that as swiftly as possible.
Todd, final thoughts?
Yeah, my final thoughts, testing. Testing is extremely important. It doesn't matter how good it looks on paper. You can be doing your due diligence and your research and think you have everything covered A to Z, but I'm here to tell you, with all the interruption tests, full interrupted tests I've done, we've always found multiple issues. So testing is very, very important, especially a full interruption test, because that's really going to flush out areas that you may have missed. And to be quite honest, we've always missed something. It seems like every test we are able to improve on something, because, until you actually do it, you're not going to be able to see if it's effective or not. There's no way you can do that on paper. The systems today are so complex, there's so much integration, there's so many moving parts, it's almost impossible without a test to flush everything out. So my best advice is, and a lesson learned, is really to do a thorough test.
Very good. Jennifer, we'll give you the last word.
Oh, thanks. So I agree with Dan and Todd on both the points they made, and just to expand a little bit more on Dan's point, because he talked about making sure business continuity, that's absolutely important. And when I speak with our customers and I look at their entire BCDR plan, so to achieve business continuity, most of the reliance is on the applications and data in the disaster recovery plan. So they're like, hey, yeah, we have 10 steps in this process, the 7 are related to the data and application. So if I can't get through those 7, I can't finish the entire BC plan. So make sure that all the pieces within your plan are working and able to support moving forward. So you're able to have that complete BCDR process in place.
Excellent, excellent. Well, that's about all we had time for today. When you close out your WebEx window, you're going to be taken to a post-event survey. If you could take a moment to answer the questions, we would appreciate it. I want to thank our panel very much for this excellent discussion, Dan Moriel, Todd Pappas, and Jennifer Gill. And I want to thank Zerto for sponsoring the event and making it possible to share this good education and information. You'll receive an email when our archive recording has been posted to our YouTube channel. Attending our webinars gets you 1 CEU for the CHIME CHCIO program. So let CHIME know you were here, and if you've asked us to do so, we will. To have us produce a webinar panel on the topic of your choice, you can contact Nancy Wilcox. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck, and of course go to our website to see our upcoming schedule. So once again, I want to thank Dan, Todd, Jennifer, Zerto, our attendees, and everybody have a wonderful day. Thank you.